On March 10, 2009, dozens of hospital CEOs stormed the Florida Capitol, urging lawmakers raise funds to increase access to health care by adding a $1 a pack assessment on cigarette sales, making it clear that there are no buts about it.
In the U.S., tobacco use is responsible for nearly 1 in 5 deaths. It kills more people than alcohol, crack cocaine, heroin, homicide, suicide, car crashes, fires, and AIDS combined. We know that raising the cost of cigarettes will prevent many of those deaths.
Raising the cigarette tax has been our #1 legislative priority. Year after year, we have worked tirelessly to show lawmakers the link between raising the tobacco tax and funding health care. In a downturned economy and the most challenging legislative session in decades, lawmakers finally listened.
Every study shows that the best way to cut back on the number of smokers is to increase the cost of smoking. We will reduce the number of smokers, we will prevent kids from starting to smoke, we will make it easier for adults to choose to stop smoking, we will cut down on the incidence of cancer in the state, and all at the same time will generate hundreds of millions of dollars to be used not just to balance the budget, but to focus on the state's real healthcare needs.
With some lawmakers already on our side, we needed to build momentum to gain more support in the House and Senate. Across the state, Florida's hospitals work together to build local support for a $1 a pack assessment on cigarettes to fund health care for the Medicaid medically needy, aged, and disabled. In city after city around the state, hospital leaders, doctors, and local business partners told the story of the medical devastation caused by smoking, the allure of low-cost cigarettes, and the critical need for healthcare investment.
Florida's hospitals and our partners were out there every single day. We were talking to the media, we were talking to lawmakers, trying to get our message across, and fortunately you could see the momentum changing in our favor.
With your leadership and support, FHA reached out to Florida's firefighters and bill sponsors to weigh in with a strong anti-smoking message. Florida's top cancer research centers and a cancer survivor described the ravages of cancer and the need for more research and treatment dollars. We released a report documenting the economic impacts of smoking on Florida's hospitals, with support from the Florida Chamber. We concluded our campaign in partnership with the Campaign for Tobacco-Free Kids, demonstrating the astounding number of cigarettes smoked by children in Florida, 15,000 every 15 minutes.
I feel the cigarette tax is the most effective way to stop kids from smoking. If you price them out, they won't be able to ever start this deadly, expensive habit. So I think increasing this tax is something that our Florida legislator needs to do to protect Florida's youth.
The effect was a steady stream of positive media coverage and editorial support and ongoing legislative advocacy.
Not only were we able to provide the legislature some cover to pass the cigarette tax, we also provided the Florida Hospital Association a chance to reassert itself as a political force in our state. You know, one hospital couldn't have done it alone, but working together we were able to assert real positive change on policy issues. More importantly, we were able to provide support for thousands of Florida's most vulnerable citizens.